by verifying that I had orders for this. And then I gather my supplies, which all I need is a suction catheter kit. Hand hygiene, patient privacy. Introduce myself. Hi, my name is Lexi. I'm going to be your student nurse today. You can verify your name and date of birth, and then they would, and I would compare that to the medical record. Now, and then I would explain the procedure. So we're going to be suctioning your trach out just to help get some of that mucus out of there, help you breathe a little better. Make sure they agree to it, and after that, I would assess their lungs and put the pulse ox on. How does this thing work? Got it. Okay, we got it. If my patient could sit up, I would do the back as well, but they can't. And I'm going to leave the pulse ox on the entire time. If it was indicated, I would hyperoxygenate my patient, so turn it up to 100% or just as prescribed. I'm using aseptic technique. I'm gonna open my kit. Wait, just kidding. Restart. Before I did that, I would come over to my section, make sure the tubing was put on correctly, and then I would turn it up between 80 and 120 milliliters of mercury. And then I would test it by holding my thumb over it, making sure it worked. After that, I would put on clean gloves again. It's all right, we got it. Everything's working. And then I would put on my clean gloves and open it using aseptic technique. Open it. I'm gonna take my sterile phasing out. Careful not to touch the inside of it. I'm just gonna fold it open like so. This is my trash because we don't have it. After that, I'm gonna take these off. More hand hygiene. And then get my sterile field ready. Careful only to touch the 1-inch border. Feel your pain. Okay. And then careful not to touch the outer part of this though. I'm gonna slip my fingers under there. This goes on. Okay, now I'm sterile. I'm gonna take out my catheter, wrapping it around my dominant hand. Careful that this tube doesn't touch anything that's not sterile. And I'm gonna take this part and connect it to the section. This hand will now be dirty. And my tubing didn't touch any of it, so I'm still sterile. And just to check it, I'm gonna occlude the hole right here and test it in normal saline, and I see that it's working. And once that's done, I'm gonna take the oxygen off using my dirty hand and put this in. And I would go until I felt some resistance. Once I do, I pull back 1 to 2 centimeters, occlude this and suction out. Do that. put that back on. And if they had suction related complications, I would only put the tubing in. And I'd be careful not to pull out too hard on that so it would stay in. If they had suction related complications, I would only go as far as the inner cannula, and then I would pull back out. I'm going to wait 20 to 30 seconds between each pass before I do an additional one, and it's going to be the same thing. I'm going to take that off and put it in there until I felt resistance, 1 to 2 centimeters back, include it, and pull it out like so. Put that back on. Making sure to monitor their oxygen the entire time. So once that's done, I would take it off, wrap it up in a glove, like so. Oh, and in between my passes, I didn't say this, but I would look at the secretions and just clean it off in the saline in between each pass, monitoring that. And after that, that's gonna bother me too. I would reassess the pulse ox and reassess her lung sounds, and then I would make sure she's in a comfortable position, call light and reach, ask her if she needs anything, then I would go document secretions, color, consistency, volume. Yeah.
Good.
Yeah.